Good afternoon, everyone. Thanks for joining us on the news briefing for this Wednesday. Monterey County has had a mobile crisis unit since 2015, but more help is on the way. The county is working to expand services 24/7 countywide by the end of the year. Along with that, the city of Salinas and the county are collaborating on a joint crisis unit that is ready to launch. And we're very pleased to have Melanie Rhodes from our Behavioral Health Bureau to talk about it, and also Sam Klemek, the police fire chief for a city of Salinas. Sorry, I almost gave you a raise or something. Thanks very much for joining us to talk about both of these efforts. Melanie, do you want to lead us off?
Sure, thanks for having us. And I'm going to go ahead and share my screen. I did put together a quick little PowerPoint here that just to try and avoid confusion, because we're really trying to build out our system and develop an integrated system. So it can be a little confusing. So I just want to go ahead and share my screen. And hopefully everybody can see that okay.
See it okay.
Perfect. Okay, let me pop that in full screen mode. All right, so oops. All right, so as Maya, as you said, we're looking at a new partnership with the city of Salinas, and thank you, Chief, for being here. I really appreciate it. And we'll be talking a little bit more about our pilot project with the city in a minute, but I'm going to go ahead and just get us started to talk about our mobile crisis services that we have had countywide. As Maya indicated, we have had some services since November 2015. Definitely has not been 24/7. We actually have been working our staff a 980 sort of a schedule, and it was mostly Wednesdays through Saturdays and some Tuesdays afternoon and evening hours. And so with that, there were some limitations. We've added on a contract with Seneca for a children and youth mobile response program in let's see, when was that? It started actually in the pandemic. So that was July of 2020 through our contract with Seneca agencies. And, you know, they help support children and youth up to the age of 21 and their families. And so we have been offering some amazing mobile crisis supportive services in our county for a while now. But there's definitely been some service gaps and limitations, as I mentioned. So what is new is for the first time ever, we will be having a mobile crisis team available 24/7 countywide, as well as standing up a mobile crisis dispatch center. But we'll talk a little bit more on that in a minute. And so I just wanted to piggyback on what we talked a little bit about last week about the launching of our community crisis line for Monterey County. Here's that information there. And why is this important? It's important because not only does it allow callers to connect to a real person in real time to receive support for a behavioral health crisis, it also, through this line, will be able to link callers when appropriate to our new mobile crisis dispatch center for a mobile crisis in-person field response once we go live here in a couple of weeks. And so this is going to create a different pathway that we haven't had before. So historically, mobile crisis services have been available through our 911 system. So if a person in crisis called into, say, the 988 line or our community crisis line, that call taker, the phone responder, would be able to provide some support to that person on the phone. And then if there were some immediate safety issues, can refer that caller to 911 to get the first responder partners going out. And then if the first responder partners, if law enforcement would like mobile crisis to join, then they could invite them to join. And so that was our system at the time when 988 launched back in July 2022. So what we have been working on and what our goal has been to build out our crisis continuum of services here in the county. And so we're taking some strides towards that here with this new model. So if a person in crisis in the community is calling in to the community crisis line or the 988 center, there will be that alternate pathway if a mobile crisis response is appropriate and there aren't any immediate safety issues, to where that community crisis line can connect with our mobile crisis dispatch, and we can look at dispatching out a 2-person team independently of 911 for the first time. So that's definitely different than how we've been operating it here. And, you know, the whole goal with that is hopefully we can be proactive so that things don't need to get to that level when a 911 response is needed in order for the community to get that mobile crisis support. So in order to be able to accomplish that, behavioral health is contracted with our new partner, Sierra Mental Wellness Group. They will be operating our new mobile crisis dispatch center, as well as launching a new 2-person team of mobile responders that will be able to provide in-person field response countywide, serving all ages, 24 hours a day, 7 days a week. They will also provide a 2-person team of mobile crisis responders for behavioral health's new pilot project with the city of Salinas, which will provide 40 hours a week coverage, and the hours of that still to be determined. And that additional team will be specifically for the city of Salinas. The Sierra Mental Wellness Group personnel will be integrated into our existing teams and really work alongside our behavioral health staff. And so for a little bit more about our pilot, I'm very excited to say that our county MOU is now finalized. So it got routed, has all the signatures done on that. So now we can get to work. So I'm just going to toss it over to Chief Klemek to see if he wants to speak more on this.
Yeah, we're really excited. This has been a long time coming and a strategic goal of the City Council of Salinas for a couple of years. We've seen about a 23% increase in our call volume in general over the last 3 years or so. And if the trends keep with what history is showing us, that is going to continue that way. That with our critical staffing shortage in the police department is something that really highlights the need to get something like this up and going. Looking at models around the country, we've taken a look at many different ways of doing this, and the partnership with the county is really something that's quite natural, because I think as Melanie talked to the continuum of services, often the police are the first on the scene to start to deal with a mental health crisis. The fire department is usually there with them, or is the second part of the response, and that person winds up in the ER. And I think this is a critical step in the continuum of really getting people the help they need and getting them the appropriate care quicker, and also lessening the burden on our really restricted resources of public safety. We're excited about this partnership. We'd like to see it expand, and we're really excited to see what the data from this pilot program is going to yield, and see where we can take it moving forward.
Great, thank you. So, as I mentioned earlier, we still have our specialized services for children and youth mobile response team, and here's the information for that program offered through Seneca Services. And let me just advance this. Oops, there we go. So really, we're looking at coming up with this layered integrated system, and it's only been achieved through partnerships. So looking at working in partnership, county behavioral health, our contracted providers, collaborating with 988, collaborating with our 911 partners, and then also looking at these partnerships with the city and the cities in the county to look at how we can collectively pool our resources. I mean, Chief Klemek spoke to, workforce shortage issues. I think we're all feeling it. And so how can we best partner and work together to pool our resources to meet the needs of the community? So just to give a quick little visual here, we're really looking at having that layered approach. So with this, we're not taking anything away. We're really augmenting the services that already exist with some of these additional resources. So I just wanted to share that number again in closing and really acknowledge that we still have a lot of work to do. This is a start, right? This is a starting point, getting us to that 24/7 level with one team, the pilot with the city. Like, we're moving in the right direction, and we're going to continue developing, adjusting, partnering, and working on building out our crisis continuum. But this is truly, I believe, a big step in the right direction for our community. So with that, thank you, and I'm happy to answer any questions.
Thank you both for sharing this information. If anyone has questions for Melanie or Chief Klemek, you can go ahead and put them in chat, or you can just say, I have a question and shout out. So I'll pause here for a second to see if everyone wants to ask a question. And not hearing any and nothing yet in chat. I do have a question. It's really dramatic that the city of Salinas took this effort to collaborate with the county and put together this pilot program. What do you think was the driving force behind, at the city level, what was the driving force to put this together? Because it's a big step to put a 2-person team 40 hours a week in place.
I think you answered your question, Maya. This is a resource intensive endeavor, and the city of Salinas, while we provide public safety, we don't have a behavioral health division in the city. We don't have all the underpinnings and the infrastructure internally to the city to accomplish something like this on our own. And then we don't want to take a fragmented approach. The council was pretty adamant about, they gave us time to do this. We knew it was going to take time, but we wanted to do it right. And the county has got the end to end. I like to call us the middle mile of this, where the county has the resources that we already participate in dispatch. So the augmentation of dispatch, and then obviously a lot of the end services that the clients will need. So we fit into the middle, we think, quite nicely. And it's a heavy lift for us, even as a city, the largest city, but it's still beyond our resource capabilities. And so this partnership is natural.
But this also allows, you're using information to drive this. You must know what's needed. Your people in the field must be seeing things that this is really going to make a difference.
We do see it every day. I alluded to our increase in call volume, and a lot of that, those are data numbers, but anecdotally, our paramedics in the field, they have these patient contacts every day, and they share the information of what they see out there and what's trending really out there in the field. And so that information gets back to us and allows us to go into a partnership like this, knowing what we think the outcome needs to be, or at least what sort of data we also need to capture to make the program more successful in the future. Whether we move forward and maybe offering some of our own services to complement this, that'll all be justified through the data that we get from this pilot program.
So, Chief, and then Melanie, in terms of data collection, when are you looking at seeing, do check-ins on the data, saying, how is it working? What kind of calls are we getting? What's your timeline to see how it's going?
I know I could speak to that for just our larger program. I mean, with having a dispatch center through Sierra as our own. Not only is the state requiring counties to capture data on mobile crisis response countywide, but we're going to be able to pull data and look at it in different ways to see the volume of calls, any trends and things for when our folks are responding. We're also going to be able to track that data for the city of Salinas and see the volumes and the numbers of calls and things that we're responding to there. And we're going to be really reviewing that on a regular, I know internally here with us overseeing our program on a regular ongoing basis. And then of course, we're going to be meeting with the city and reviewing that collectively together, probably very frequently initially. And, we got to get up and running first, and then we'll be meeting regularly, monthly, quarterly, as often as we need to really examine how the program's working and adjust as we need to, because we haven't done this before. So there's going to be a learning curve.
And then finally, we're talking more and more about increasing mental health services. For a while, we talked a lot about it, and it didn't happen. Now it's really happening. Do you think this is just a next phase in the importance, the renewed importance that communities are placing on mental health services for residents and their needs?
I think, from behavioral health, we see it every day. The chief spoke to what they're seeing and what their folks are coming into contact with and every day. We're seeing it every day too, from the behavioral health perspective, whether it's, the calls we're getting, the folks coming in to try and access and get connected to services, whether that's how things are presenting in our schools or just in different areas. We definitely know the need is out there, and the acuity level, has, perhaps maybe even built up over time, still coming out of the pandemic and things where, I don't believe we fully have seen or felt the full, ramifications and how folks in our community were impacted by the pandemic. And so I'm just really happy that we're normalizing this, that we're making resources available also more proactively. So, as opposed to just that reactive approach about where things have to get to 911 in order to send out the support, right? By having that community crisis line as that gateway also to, get folks help sooner rather than later. Hopefully we can, avert some of those crisis situations from getting to that 911 level. So that's our goal. We're starting small. We'll continue to look at the data and grow as we're able to. And, but this is a big step forward, I think, for us here in the county.
Chief Klemek, any last thoughts or add-ins on the topic you'd like to share?
I would just add to this that, we see the linkages between the issues of, behavioral health, the linkages to homelessness, that the city of Salinas has really invested a lot of effort and resources into trying to combat. State resources, federal resources becoming available now. So these linkages they're staring us in the face. And hopefully what we hope to see out of this is just another tool that we can use that's going to help alleviate some of the other issues that are really, really plaguing us, like homelessness here in Salinas and all over the state, frankly. And again, our precious public safety resources that are really, really taxed right now.
Thank you, Chief Klemek, and thank you, Melanie, very much for talking about this great and really exciting new program. And we really look forward to having you back to talk about the data when you've got some information to share. Speaking of homelessness, that is our next topic. The county and its partners have been making some great strides in assisting residents who are homeless, but knowing the number of people who are homeless is very important. One way to do that is, and to find out, is through the biennial unsheltered point in time count, and volunteers for that effort are needed. Mahnoor Abbasi from the Coalition of Homeless Services Providers is joining us today. She's going to talk about how people can get involved, how they can volunteer, and really the importance of the point in time count. Hi, Mahnoor.
Hi, Maya. Thank you so much. I really appreciate you guys giving me the opportunity to talk here today. I'm gonna share my screen in a little bit, and please let me know if you guys can hear me okay.
Yes, we can hear you.
Okay, awesome. I'm just trying to, okay, there we go. Can you guys see my screen?
Yes.
Okay, awesome. Yeah, my name is Mahnoor Abbasi. I'm the governance coordinator here at the Coalition of Homeless Services Providers, and I'm here to talk about the 2024 point in time count with you all. And yeah, so just to go over what PIT count or point in time count really is, it is a count of sheltered and unsheltered people who are experiencing homelessness on a single night in January. And this is mandated by HUD, the State Department, Housing and Urban Development. And so the importance and purpose of point in time count is that it really helps us establish the dimension of the problem of homelessness. And it really helps the data and the numbers that we get when we find out how many people are experiencing homelessness on a single night. That data and the numbers help the policymakers at Congress and other policymakers to really track progress toward the goal of ending homelessness and come up with the strategies and make sure that we are able to house all the people who need housing, especially for our counties. So we are the COC Continuum of Care. So when we talk about our county, we're also talking about San Benito. So we make sure that we count all the residents who are experiencing homelessness in both Monterey and San Benito counties. And so our scheduled PIT date and time is January 31st, 2024. It's a Wednesday, and the time is between 5 a.m. and 10 a.m. And yeah, we're actively recruiting volunteers for the point in time count to make sure, as I already mentioned, that we cover the tracks in both Monterey and San Benito counties. And then for this, we are making sure that we contact the outreach teams. Our partner agencies that we work with are member agencies that the coalition works with, and their importance cannot be overstated. Some examples of the teams that we have been able to recruit for this purpose are, for example, the Community Health Engagement by CSUMB, City of Monterey. I recently talked to them. They are also putting together a team for this purpose. The Street Outreach Team by City of Salinas, they're called SORT. Then Dorothy's Place, and then I recently was able to pull in, and I really appreciate that they have been really supportive so far, the Community Action Team by Monterey Police Department. But we still, because it's a big county, we want to make sure that all the tracks are covered. So for this, we are still recruiting volunteers, and we would really, really appreciate you guys helping spread the word. So the next slide is the deployment centers. So deployment centers is basically, they are the locations where the volunteers will gather on the day of before they depart to record the data and the numbers and to go and participate in counting all the residents who are experiencing homelessness. So on Peninsula, we have our own office acting as the deployment center. We're based in Seaside. And then in Salinas, we were able to book a conference room with the United Way Monterey. And then for San Benito, we were able to talk with the San Benito County themselves. So the office in Hollister, and it's called the Community Services and Workforce Development. So these are our 3 deployment centers on the day of where volunteers will gather, and then they will go on from there. And I just wanted to go over and show what the map looks like. So we are using the software ArcSys, and we are tracking to see how many tracks. Because so we divide the county of Monterey, the Monterey and San Benito counties in different census tracts. And then each track is then assigned to different folks or volunteers. That's why we need volunteers. So the ones in red you can see are the ones that have been claimed already, and the ones in blue are the ones that we are trying to recruit volunteers for. And these are the volunteer registration links. I can drop them in the chat. And I would really appreciate if you guys could spread the word and help us recruit more volunteers. We need all hands on deck, and the more people we have, the better chance we have at accurately looking out and making sure that we can count how many people need housing in Monterey and San Benito, and together we can effectively reduce homelessness in both Monterey and San Benito counties. And that's it. Thank you, and I will drop the links in the chat.
Thank you. Thank you so much for running through the importance of the event, the point in time count. I wonder if you could describe what people would expect to if they're going to volunteer. What might those 5 hours look like? You know, from the kind of towards the beginning where they're getting ready, and then they're going to go out into the field. And what can volunteers expect?
That's a great question. So depending on their location, for example, if they're based on Peninsula and Monterey, we'll all gather here at our office in Seaside at CHSB, and then we'll kind of give them the instructions. Mid-January, we're planning to have proper trainings for the volunteers, so they will already know what is expected of them, so that they know, because they will be having an app on their map by the federal government, which helps them record the data. So how to use that, how to navigate the technology, and how to make sure that you count the encampments. And all of the outreach teams that we are trying to recruit, we're making sure that there's at least 2 people who go together. So one person might drive the car and the other one can just get off, or they can stay in the car if it's easier, and then record the data. So that, I hope that answers the question.
And Katrina McKenzie, also, would you like to add to that?
Yes, so I've done every single point in time count with the coalition since 2016, and the way that Mahnoor pretty much encompass the process well, but there's another aspect to it where if people are comfortable, if volunteers are comfortable, they're paired with a trusted homeless guide that also would be helping you lead into census tracts they are familiar with. So the teams, nobody goes out alone. We go out in teams of 2 to 3, maybe even 4 people to make sure for safety purposes. We will be doing these electronically as well as hand forms. So people who may not feel comfortable with the technology, even though we'll be offering training prior to the event and on the day of, we do offer old school census tracts, papers with pens, and to mark everybody out. So CHSP will be holding down the deployment centers, more like command centers as well, like so that our volunteers have a contact person that they connect with. We can watch as people are entering in data. We could follow up with people who are maybe are not entering data or need help troubleshooting. We'll be offering that technical support as well as monitoring for safety, making sure that people are going to those tracks, that they're checking in at certain times, so that we make sure everybody is accounted for.
And then there are a lot of census tracts that you showed on that map. And for people who might be wondering, how many volunteers do you need at this point to do this? And then when do you want them to sign up? Because it sounds like you want them to have training before they go out.
Yeah, so although we would love to have them trained, fully trained to ask questions prior to the event, like we said, we'll also be offering those trainings at the day of, because some people come, you know, at the last minute, they heard of something and they just, or their schedule changed and they want to participate. So we'll be offering both of those. And we would love to have all our census tract assigned by mid-January, but you know how that goes. We do our best. Mahnoor is also working with Patricia Zurunian from the County of Monterey to help us solicit more volunteers. She participated in years past and will be continuing again this year.
And just to add to that, Maya, I'm also thinking about like putting together a training because I do understand that right before the point in time count, I'm sure that we will have more people signing up the day before and the week before. So I'm sure that there's a lot of people who are going to miss the trainings. But so I'm trying to make sure that we put together something that is really fast and effective and people can learn about it through a video or just have a document ready for them to go so that they know what they're supposed to do and they are able to navigate the process with more ease.
And you also need a lot of volunteers. And I think that's something we really want to make sure people are aware of. We're not talking about needing 5 people or 10 people. We're talking about needing a lot of people because there's a lot of ground to cover.
Yes, so we typically shoot for 200 volunteers, and we have yet to hit that actual 200 mark in every year that we've done the census, but we always make sure that with the volunteers that we have, all of our tracks are covered. But we want to eliminate the burden of assigning too many census tracks to teams. So we lean on, you know, our outreach teams to take on large familiar census tracts which is highly populated, but there are census tracts like, you know, Carmel Valley or Lovers Point, where, you know, it's just a nice, beautiful drive, but we would rather those go to regular community volunteers. And so right now we are in desperate need of volunteers. I think for Monterey County, we're looking at just the actual surveys that came in, probably about like 50, but for each one survey, people are signing up multiple people. So we're still working through those numbers to make sure how many people are included in those 50 surveys. And then we'll know soon, hopefully.
And then the last thing I do want people you should share is that you're going out at 5 in the morning until 10 in the morning. And you need to dress warmly. So talk about not only the safety of, you know, going in pairs, but, you know, dressing for the program.
Right. I think it was maybe 2018. It was a really, really bad weather time and it was raining and, you know, everybody still came out. We had Supervisor Alejo out there with his boots and his jacket, his hat, his umbrella, flashlights. So those are all things that you should really prepare for. Some census tracts are drivable tracts in which you do not need to get out. Some are boots on the ground. You need to get out and walk those tracks. So really preparing for that and being forthcoming in what you can and cannot do. So you may be assigned a track and you take a look at it. That is a discussion you can have with somebody on site or remotely on maybe getting assigned another track if that doesn't fit your needs or your abilities, I should say.
I think what you're saying, Katrina, is close to the kind of question we had in the chat. If you want,
yeah, and I was just going to ask that question because we're streaming this later. I want to ask the question so everyone can hear both the question and the answer. So this question is: are there some census tracts that people tend not to volunteer for over others? So what would be your message to people who are slightly hesitant to sign up that could potentially, you know, help assist the areas that maybe are less popular?
Right. So I haven't had encountered anybody saying that they did not want a certain track. But I have had people say that they don't want a certain area. Like I'm more comfortable with the peninsula side and I would like to go in that area. For people that might be hesitant to volunteer because they'll get a track that they're not comfortable with, I think it's really just letting them know that they have that choice and that it could be communicated to staff to make adjustments and to give you a track that you are comfortable with. but we make sure that every track is covered. So although there are unpopular tracks, CHSP, the County of Monterey, and the census committee assures that all tracks are covered.
Any last, before you go, I do want to make sure you send me your slides, Mahnoor, because people would like them. Any last thoughts, any last information you'd like to share?
If you can just please share our flyer and our link with your partners, maybe any groups within the community that you tend to connect with even outside of work. It's a community-wide event. This isn't just left to our service providers, our county workers, or city workers. It takes us all to address homelessness in our home. And we want to make sure that funding is secured by getting accurate counts. All of our funding that comes out state and federally depend on these numbers. And we live or die by these numbers for the next 2 years, since we only do it every other year. This is an unfunded mandate, and we assure that we go out and make it happen every other year.
And then one more question that just popped in. Are people, or the volunteers who do this, are people asked to approach encampments, some of the larger encampments? And is there a protocol for, this may be covered in training, a protocol for people in doing that? You talk about going out, never going out alone, but there could be some other precautions that you're asking people to take beyond that.
Definitely. So we're so blessed in the way that we have some great outreach teams that know of all of these encampments. So we assign those census tracts with encampments to our outreach teams who are familiar with these. So what has been happening is Mahnoor and Applied Survey Research has been meeting with these encampment teams on a regular basis to look at these census tracts, and they know exactly which ones are highly populated with encampments, who's in those encampments, how many people, their demographics, everything. So these aren't census tracts we would assign to a general community volunteer. We make sure that we're sending the right people for encampment tracts to those places, so that everyone is safe and comfortable. In prior years, we have also implemented a different strategy in which outreach teams connect with encampments, and they give them the survey ahead of time, in which they can go out and fill out, and then they turn it in the day of. So then we eliminate going into the encampment at all.
Thank you for that. I think there's a lot of curiosity about this process, and I think those answers really help. Any last questions for Katrina or Mahnoor?
I would just like to second what Katrina just said, and just to answer Victor's question, it's just that a lot of our outreach teams have been going out on these tracks for so long that they have built up rapport, and they know these people, and they have really good and positive relationships with the people who are living in the encampments. So they already have a pretty good idea of how many encampments there are in a certain area. And so we're confident that when they go out on the day of, they are not only already familiar with the encampments, but they'll do a great job. So that's a great point, that we have the outreach teams, and the fact that they're really familiar with the tracks that they have been covering for a long time.
And then also just one more little nugget. If anybody comes across encampments that, like, just prior to the event, please let us know of those locations. We are mapping out encampments, and want to make sure that our teams are well aware of them. So if you come across an encampment that you think that we're unaware of and just want to make sure, send it our way, a general location of it, and we'll connect with our outreach teams to make sure, one, that they are aware of this encampment, two, are they outreaching in that community, and are those people getting services, and three, that ASR is well aware of them, and that they are added to our census tract to assure that our outreach teams get assigned those tracts.
Thank you both very much for joining to talk about this. And we really hope you get all the volunteers that you need for the county. Really a great program. Thank you so much.
Thank you for having us.
Thank you for the opportunity, and I shared the flyer with you, so we really appreciate it, spreading the word around.
Fantastic. Thank you. And then finally, we've got a little bit of great Christmas news for local fishermen. These anglers, our local anglers, are getting a gift. They're getting 5,000 rainbow trout, which have now been stocked at Lake San Antonio, and they are making themselves at home in the water. We've got Nate Merkle. He's the operations manager for South County Parks here to talk about this great restocking of the lake. Hi, Nate.
Hello, and thank you for having me. So I did just want to notify everybody that California Department of Fish and Wildlife actually determined that Lake San Antonio would be perfect for an annual trout stocking of 30,000 pounds. The frequency, the timeline, and the amount of fish that will actually be stocked are dependent on a lot of various factors, which one of them is fish availability, the reservoir conditions, as well as road conditions to access the lake. The first stocking was 5,000 pounds of sterile or triploid rainbow trout at Lake San Antonio North Shore at the new ramp location next to the old store. And we are hoping that another plant rather will take place shortly. But again, we're not 100% certain on timeline at this point. And just rainbow trout are fantastic fish for anglers. They're really heavily sought after. So we are hoping for an increase in visitation, especially in the winter months, for anglers to catch those. So with that, I'm happy to answer any questions.
Yeah, if you've got questions for Nate, go ahead and put them in chat, or you can shout them out. This is really a big shift because we've only had, I think, striped bass at the lake. And so this is really an expansion of what anglers can do at the lake.
Yeah, that's correct. And actually the last trout plant was around 1985, I believe. So it's been about 40 years since we've planted trout.
And why is it taking so long?
Actually, I believe they tried previously as well, but the stripers were such a large and predatory fish that it wasn't really a good idea to plant trout because they would just end up in the stripers' bellies. So for the most part, the striper population has decreased enough at Lake San Antonio that Fish and Wildlife was confident that the trout plant would take hold.
So so you talk about this being the first stock. In order to get 30,000 pounds, that's a lot of fish.
Right. There would be about 6 individual plants. So they typically come in a truck with about 5,000 pounds of fish. And again, we're hoping that they occur again in the next few months, but the determination of when that happens is made by CDFW.
So for people who don't fish, and I'm one of them, if somebody wanted to come up and fish in the lake, do they have to have a license? Do they, what's the process for fishing there?
Yeah, so anywhere you fish in California requires a fishing license if you're above 16 years old. And the shoreline fishing actually for trout is going to be really exceptional at North Shore Lake San Antonio. For boaters, people fishing off of boats, they can launch 7 days a week at South Shore and travel over to the North Shore side. But really, you're looking to go after the coves, the shallower coves at North Shore to catch these trout in particular. But yes, a license is absolutely required.
I'm sorry, that was one of those silly non-angler questions, but are there any other questions for Nate about the fish or anything else going on at Lake San Antonio? Are the holidays going to be active down at the lake? And it may be raining there as it's raining here.
Yeah, entirely weather dependent. We are expecting a few campers here and there at Lake San Antonio South Shore, but for the most part, for anybody looking for an escape, especially a quiet escape, now's the time of year to do it at Lake San Antonio.
Thank you. And thanks for sharing this really terrific news. It's just, the lake is just fantastic with more water. It's, the lake levels are up and now you've got more fish. So there's really a lot more to do down there for people who love that lake, the locals who love it.
Thank you.
Thank you very much. And thanks everyone for joining us on the news briefing for this week. We will not be having a news briefing next week. And so our first briefing will be in January for 2024. Good afternoon, everyone.
Thank you.
Thank you. Happy holidays.
Happy holidays.